Hi, I'm Dr. Ivan. Some people call me the smile doctor because I do a lot of smiles and help people have the most beautiful smile possible. But I'm here to talk about facial aesthetics and what we do here at Radiante. A lot of people go to spas, med spas, and doctors to get injectables and Botox and dermal fillers. And I will tell you that, as strange as that sounds, most doctors and nurses have never been trained properly in injectables. I've always believed in a sequential learning program to learn how to do something. So when I first started learning how to do cosmetic dentistry, I went to institutes that were sometimes as long as 2.5 years before you completed the program to learn how to do something. Those are extremely valuable continuing education in dentistry. So when you go to the med spa, typically you get discounted, Botox, and you're charged by the unit. And of course, many patients come out overblown, over volumized, and we have names for sometimes what they do to people's lips, duck lips, and it's unattractive. And what we try to do here at Radiante is we try to create a more youthful, healthy look without over volumizing. And a lot of doctors and nurses who inject and haven't been taught properly to do it inject in creases, thinking that they want to eliminate the crease, or like on your forehead, they try to eliminate the creases in your forehead by injecting into the creases. And that's actually the wrong way to do it. It's a muscle that creates those creases. So what you want to do is you want to activate the muscle or deactivate the muscle that causes those creases. You're not necessarily injecting in the creases at all. You're injecting in the muscle. Same with jowls. A lot of women hate jowls. I cover mine up with a beard that I just grew recently, and didn't know that it was so gray. But to cover up the jowls adequately, a lot of doctors and nurses inject right around the jowls to try to reduce how that puffiness is down there. And that's actually the wrong way to do it. The way to inject to properly get rid of jowls is to actually increase the volume of the cheeks, which reduces the jowls underneath here. And since we lose volume as we get older in our cheeks and they get flatter, we want to add a little bit of volume to the cheeks, and it reduces the jowls to a certain extent. And we provide a combination of treatments to help people. It could be fillers here, Botox there, and actually I don't charge by the unit, I charge by what we're trying to do. If we're trying to accomplish something on your forehead, we charge for the forehead. If we're trying to accomplish something in the entire face, we'll charge you for the different fees that we charge to do the entire face with whatever it takes. Juvederm, Radiesse, there's all sorts of things that we can use. And since we're cosmetic dentists, we also look at your jaws and your teeth and how your teeth support your lips and your face. We find so often the people that complain the most about their smiles are people that have what's called a class 2 overbite. They have a really small chin, they have that turkey neck appearance that they hate when you take a profile picture on them. And so sometimes we can do, it's been called all sorts of things, non-surgical facelift, but we can do a bite change and a jaw position change dentally without any surgery, and it puts your jaws in a little more elongated position, reducing a lot of perioral wrinkles and reducing the turkey neck. It's a really quite a wonderful treatment. People are very grateful for the way they look afterwards. So, the point is that we at Radiante, we can offer those now. We can offer the cosmetic dental treatment along with facial aesthetics and injectables. We have an esthetician here. In fact, when you come to our office, the first thing we're going to put you through after your examination is with the esthetician to type your skin, to really understand how the skin is and get it as healthy as possible naturally with natural products. We use some very nice products here in the office with all natural ingredients rather. And we do that because if we don't understand what type of skin you have, the thickness of your skin, the quality of your skin. You can inject all you want and you may not solve a problem. So we want the esthetician to evaluate your skin first, on your face and on your neck, and then we create what's called a facial profile, or a map of what we're going to do, how we're going to accomplish it, and we can also talk to you about how the teeth support the lips and create the wrinkles around the face. And so we have that unique ability to tackle it to tackle facial aesthetics from a dental point of view. And if you didn't know that dentistry has a large part of support for your face, just take your teeth out of your mouth and watch what happens to your face. It's a very important part of the face, and you don't see too many dental and facial spas like Radiante because they don't exist. People always thought they were separate, but they're actually very intimately related. And I was always frustrated through the years with my patients coming back from plastic surgeons, and I could, with chin implants and all sorts of things, and I thought, boy, there's a lot easier, less non-surgical way to remove those perioral wrinkles and the creases in the lips if you just had some cosmetic dentistry done. And cosmetic dentistry, of course, I believe in greatly. It's I've seen people's lives change, improved mostly, and people just feel great about a great smile. It's one of the first things people notice about you. It's one of your greatest assets, and it's so important in your esteem and confidence. So often people ask me, well, what do you do for a living? And I used to try to beat around the bush and say, well, I kind of help people out. I help them look better, but really what we're doing is we're giving people confidence. And that is the number one thing that people are asking from me, and it is what we deliver. We deliver confidence. So I could go on and on and on, but these videos should not be too long. I hope you enjoy this one, and I'll talk to you next time we create another video. Bye now.